Hi, I'm Dr. Vimibindra. I'm an endometriosis excision specialist based in Hyderabad, India. Many of our patients or endometriosis patients have this query how to choose their surgeon. So, there are a few things which I'm going to tell you in this video how and what to look for when you are choosing your endometriosis surgeon because we don't want our patients to land up with multiple surgeries. LAPEX or laparoscopic excision surgery is a high quality multidisciplinary approach for endometriosis treatment, and evidence has shown that it has very good results. If you are choosing your endometriosis surgeon, the first and foremost thing is your surgeon should listen to you properly, and this is an art called as anamnesis, where they will take your proper history, listen to you what you are going through, and based on that a diagnosis can be made and proper imaging, and finally excision surgery can be done. You should also be sure that your surgeon whom you are choosing should lead a multidisciplinary team where they should have a psychologist, nutritionist, colorectal surgeon, neurosurgeon, thoracic surgeon. Any organ, if involved in endometriosis, should be addressed at one sitting and not at multiple sittings. So if I take a patient for surgery, I should be handle their endometriosis at the diaphragm, at lungs, at heart, bowel, rectum, bladder, ureter, anywhere. Imaging sometimes may not tell us all the locations of endometriosis, but with high resolution good imaging, we are able to pick up almost all lesions. But in spite of that, we may find some lesions or superficial lesions during surgery, and we should be able to excise them irrespective of their location, and it is possible only because of multidisciplinary treatment. Excision is just a part of it. Your surgeon should also guide you regarding the post-surgical management, like there are some dietary changes, lifestyle changes, pelvic physiotherapy, which will help you in the long run managing your endometriosis symptoms well. As a doctor, what I want my patients to come to me with is a proper menstrual diary and a pain diary with respect to visual analog scores and the exact location and duration of onset of their symptoms. Whether it is radiating pain or it locates to only one side, it is aggravated by some factors, comes down with some of the factors. So these are the things, if we get these important information from you, it becomes easier for us to diagnose your pain and give you a diagnosis at the earliest. Laparoscopic excision surgery or robotic excision surgery, the robot and the laparoscopy, they are only the tools. It's the man behind the machine who can do the surgery. So surgeon can have their different ways of doing it, but the surgery has to be complete. All lesions should be excised at one go. Endometriosis sometimes can be invisible or we cannot identify during the surgery. That may lead to your recurrent symptoms even if you have undergone an excision surgery. So a good excision surgery definitely gives you good quality of life and good surgical outcomes. But it also does not mean that endometriosis may not come back. Choose your surgeon wisely and help us to help you better and help us raise awareness for endometriosis as well. Thank you.